Hello and welcome to Enjoy the Wander. I'm Eunjee.
I'm Hee.
And I'm Ryan.
Welcome, Ryan. Welcome to the show. We're so excited to have you. Ryan is actually joining us after a 24-hour shift. But before we jump into that, we would just like to kind of introduce Ryan. He is our house church shepherd. So at New Life, we do something that is the house church model. And Hee and I are in the same house church led by our shepherd Ryan Lay and his wife Judy Lay. And so we are connected in that community. Ryan, along with several other members of our house church, are deeply plugged into the healthcare profession, medical profession. And so we get to hear a lot of inside stories of what's been going on. And Ryan, we feel like, has just so much experience in a world that we are not familiar with. So we wanted to invite him onto the show to share that with you guys as well.
One of the reasons that we wanted to do this series, especially, or one of the things that we wanted to focus on in this series, is seeing the two different worlds coming together at one point, right? And so previously we talked about students and teachers, and in this episode we're going to be talking to doctors and patients, folks who've actually had COVID in the past, and talk about where those two perspectives can meet. And so we're really interested to see what Ryan's perspective is throughout all of this pandemic, because he's really been in the front rows, of this worldwide pandemic, and just some of the struggles and dark things and some of the hopeful things and some of the changes that have been happening over the last few weeks and months as the vaccine's been rolling out. And so, we're just excited to learn more about Ryan and see what his work is like, and how his identity has shifted over these last few months.
So Ryan, what are you?
So I'm Ryan. I'm a third year med peds resident, and for those who don't know, med peds just means that I am dual specializing in both pediatrics and internal medicine. So I see the whole spectrum in terms of age, from newborn babies all the way to the 18-year-old mark, and then when they transition to become adults, 19, until the geriatric population. Sorry, that sound in the back is my daughter. Yeah, and she's watching Zootopia. Yeah, good job, Abby.
We've actually seen Ryan throughout his residency process, right? Starting off dual specialized, like residency itself is so busy, and dual specializing being in the thick of two different specialties and really intensive, I guess, practice in both. And so we've already seen him like really trying to juggle, like you heard, like fatherhood, being the leader of our house church, and then obviously a very demanding residency program. And then now COVID comes as well. And so we would love to just kind of hear a little bit about what life was like pre-COVID, and then also what it looks like for you right now being in the front lines.
Yeah. So, I mean, prior to COVID, life was always busy. I mean, as a resident, it's always, I think, not being home. And so, like, Abby was born my fourth year of medical school. So, really, when I started residency, she was one. And just not being home to help out my wife, Judy, I think I felt a lot of like guilt, but also at the same time, because I mean, I like what I do and I really enjoy it. So I think part of me feels a little bit of guilt for not being able to be around to help her. But at the same time, it's not like my life was like very easy either on the other end. And so I think like being physically tired and then emotionally tired was kind of a lot. But I think, and it took a little bit of time, but I think we were able to kind of find a good medium, a good balance. And I think that's also something that we're still trying to figure out in this ever-changing world, especially with the pandemic and everything going on.
What made you want to choose med peds?
That's I get this question all the time. So when I went to med school, I wanted to pursue. I was thinking of pursuing pediatrics because that's all I had kind of seen and known before. And then when I went to medical school, I really fell in love with medicine and like adults and like just taking care of really like sick people. And I think I always had this idea in the back of my mind that med peds is not something. I felt it was like a little bit more competitive than maybe something that I could achieve or obtain, but it was just something that I was really passionate about. And I think even, as a believer and as someone who I feel like God has really gotten me through medical school, got me through residency, I just felt very like led this way. And so I just prayed and I just trusted. And I just went for it. And I think God really was with me. I managed not only to match into this specialty that I was very blessed and shocked to have been able to match into, but also to stay in Houston, which was my ultimate goal, was to stay here in Houston with my family and with Judy's family. And
Mm.
so, yeah, I think just trusting in God helped me get to where I am. But I think I really feel like God placed that passion in me in the first place, and just trusting helped me get where I am, I guess.
So it sounds like, you feel very confirmed in this calling and this dual specialty that you did choose. And so, like, we've seen you tired, and we know that the residency program is very demanding. And then, you talk about the beginning of last year, and you were talking about in March, you're going to be in the ICU unit. And then March was also when the pandemic hit hard here in Houston. I would love to know how that experience started for you during like serving in the front lines during this COVID-19 pandemic. And then also when things were finally kind of looking better for at least our local community, you were then placed in the ICU again in July, which was the other peak. Did residency then look different, or did it just maybe look different because it was COVID?
Yeah. So, I mean, being med peds, I see the gamut of adults and kids and everything in between. And so in March, when this first kind of started, I remember I was in the ICU over at Memorial Hermann, the medical center. And I remember I was on a night shift actually, and it was Rudy Gobert, the Utah Jazz center, who tested positive for COVID. And at that point, they shut down the NBA. And I remember distinctly being in our little like workroom and realizing, oh, something is like about to happen. And over the next day or two, I remember I was working on nights. The hospital policy, we started talking about COVID. And this is when like our hospital system had no idea how to respond. We didn't know what to do. We didn't know if we should separate the ICUs. We didn't know what we could handle or how we could handle. And everything was in flux. And there was so much chaos and so much uncertainty towards everything. And that's when we were running out of PPE, or were we really running out of PPE? And then the CDC, gave the recommendation to not wear masks, but then a few days later was saying that we all needed to wear masks. And so on all levels, as on a personal level, as a one person, physician, a healthcare provider, not we were all confused, but then also seeing on a systemic level of like the hospital not knowing what to do, how to separate, and even our nation, our Center for Disease Control didn't know what to do. I think everyone was at a loss of how to approach this on all levels. And then so from there, I think I left the ICU, and we were still confused at that point. I moved on to my next rotation, which was in the pediatric world. And so everything was more, at this point, I remember we were all we were all adjusting to working from home. We were all adjusting to social distancing, and so everything was kind of quiet. I went back into the hospital on the pediatric floor, and there I took care of a few. I mean, it was a lot quieter, just because a lot of diseases that kids get that cause them to be hospitalized are from spreading germs to one another, right? So when they go to daycare, when they go to school, and these kids weren't going to school anymore. So our hospital, the pediatric side of the hospital, was pretty empty. We had a few patients, and some of them were COVID. So I think the youngest COVID patient I've ever taken care of was 7 days old.
Wow.
And yeah, that experience was, it was so different than, I mean, backing up a little bit, in the ICUs, we took care of these 20, 30-year-olds where we didn't know what was going on. And we would swab for COVID. I remember one patient we swabbed at least 10 times. And each time it came back negative, but we were convinced it was COVID. And we didn't know if these tests were even accurate at that time. And it took days for it to come back only to be negative, and we would swab again. And then fast forward 3 or 4 months later, and we swab, and there's the turnaround time, sped up a little bit to 2 or 3 days. But again, like what does that, I don't know. And so we had that information faster, but I mean, it didn't really change our management in the sense that we just kind of quarantined the person and then asked them to go home. And then fast forward a few more months later, and I wasn't in the ICU in July. I was actually on the medical floor, but it was at our county hospital at LBJ. And so there was, at this time, there was a surge in Houston. Talks of hospitals getting full were happening. And they really tried to protect our residents from seeing too many COVID patients. But because our hospital system was just overwhelmed with the amount of COVID, that at one point, 75% of the patients that we were seeing were all COVID. And even at this point, our residency program didn't know how to handle it. At first, at the beginning of the month, they were saying no medical students and no interns were allowed to see these COVID patients. And then it just became overwhelmed our system. And so it was pretty much fair game. And yeah, so then we took care of COVID patients, and these patients who they just come from lower economic backgrounds, and so they really struggled with resources. And like listening to their stories is heartbreaking. You can ask certain people to quarantine, but there are some people who can't quarantine.
Yeah.
Yeah, and so it's awful and it's sad. And yeah, I mean, sorry, I'm just like all over the place because there's so many. I feel like the journey has been so long. Now that I'm like sitting back and reflecting on everything. Yeah, and sorry, I feel like I'm just kind of rambling right now.
So as I was listening to your
Rambling, it's okay.
story of like, I was listening to like where you guys started, the process that it's taken. I feel like along the way you probably faced a lot of difficult situations where you really had to make decisions or think through situations where there's no like clear cut answer. How do you feel like the different identities that you hold, whether that's like doctor, father, Asian American, etc. Like, how did you feel like those helped you figure stuff out? How did you like rely on those as you went through those difficult situations in the hospital and as a doctor and even like at home during the pandemic?
So I'll give one story. I think the 7-day-old baby that I took care of, with kids, any sort of fever or infection less than 1 month is really scary. We always ask our parents who, with any baby less than 1 month old who has a fever, they need to come into the ER. So the story of how this child got COVID was that, so the mom was carrying their newborn baby, and the dad was in a crowd, and he was hurt. And so as she got closer to him, there was a crowd of people surrounding the father, and she was running to him, and I think that's where she thinks that her child got COVID. Um,
Mm.
and it was just like heartbreaking to hear. And then when they came into the hospital, our hospital system didn't know what to do, and mom, who was in the hospital at the bedside of her child, and she was starting to clearly get sick at this point. So she hadn't gotten tested, but we all knew what was going on, right? She had the fever, she had the cough, she had all the symptoms of COVID, and her newborn 7-day-old child had tested positive for COVID. So we all knew what was going on, but because there was no confirmatory test, I think even as a hospital, we didn't know what to do. Should we make her leave? But then if we make her leave, then she's not going to be allowed to go back to her baby. And so it was just this very awkward and difficult, strained kind of situation. And I think as a father, my heart broke because, I mean, there's nothing like a mother's love for their child, but as a father, seeing and knowing that, dad can't come because he's in the hospital somewhere because he's hurt. If mom leaves the child, then no one can come to the child, right? Just because of hospital policy. And if she's positive with COVID, which she likely is, then she's not going to be allowed in. And so it was just this very, like, my heart broke for this family. And I think, I remember her pleading with me just to help her, and I had no idea what to do, and I don't even know if she knew what she needed. But I think we were all just kind of at a loss, everyone involved in the situation. And I think as a believer, I felt like there was nothing I could do except really just pray for this family. I don't think the hospital knew what to do. I don't think the doctors knew what to do. I don't think even the patient knew what they should be doing. Having that different perspective, not just as a physician, as a family. I mean, I think all sides of me was just at a loss, if that answers anything.
No, I feel like that encompasses so many, like the response in all of the identities you do carry, right? And how you are at a loss of words. And it's like it's kind of like not ironic, right? But like we've just seen you in the thick of it, right? And you lost a lot of sleep. You were serving a lot, and it's just like amazing how you're even in my eyes thriving right now, right? And here you are coming off a 24-hour shift because now you are volunteering to go into the COVID ICU units. How does that happen? Almost like, where do you feel now? You have this, like, not necessarily comfort, right? It's not a comfort thing, but you have more of an, okay, like, I'm going to go and help, and not because it's a rotation, but almost like you're volunteering, and that's really admirable. And I would like to see like how that mindset is, where now you want to be there, and what it looks like.
That's right. Nick said no. I think volunteering is too nice of a word. I mean, we're getting extra money to go to to go into the COVID IC at this point. Um, I mean, I think what I discovered about myself throughout this pandemic is that there's always been this side of me that really has been attracted to taking care of really sick people. And it was always something that kind of like was in the back of my mind. And I think this experience has really confirmed to me that I really am interested in critical care. And I think dealing with working with so many COVID patients and really opened my eyes towards pulmonary medicine. And I think that's kind of where my heart is right now, where this may be the next kind of step that is laid out in front of me, maybe to pursue
Mm.
this path of pulmonary medicine. And I think getting to go into these situations or these work extra in the COVID ICU helps me to get more experience and learn more. And I was telling Judy yesterday that I feel like I'm learning a lot, but I'm not sure if I'm learning the right things because these COVID patients, we're maxing out on these settings that traditionally we're not trained to do, but we have no options and no other choice. I feel like I'm learning a lot, but again, I'm not sure if I'm learning the appropriate things, if that makes sense.
Yeah. But I mean, I think in all these, like, we heard from the education experience, all these schools are putting in systems. Do we know if they're correct? No, but this is the first time. So I think even with hospitals, right? Do we know if it's all appropriate or correct? I'm sure you guys are like not as like confident as it sounds to us, quote, quote, common people. But, like it's the first time. So
Yeah.
like how do you respond in terms of in the daily, and you know a lot of friends that might have gotten COVID, right? And then thankfully at least the mutual friends we know like have taken care of themselves, recovered, and kind of on the onwards like upward slope. But then you work in the ICUs where you see like a drastic shift in what that looks like. And so how do you almost marry those two very different but not equally same, very different realities? They're both realities, but they're such jarring realities. So how do you kind of like let that simmer in your just like daily life, and how you approach things?
Yeah, so I think at baseline, I'm a very laid back, oh, it's okay kind of type of person. And so, I remember when COVID first started and none of us knew what was going on. At one point, I thought to myself, oh, it might just be easier if I just get COVID and recover, have antibodies, and go on with my life instead of having to like be so scared of it. As foolish as that sounds now, I think that speaks to my like personality. Like I'm very kind of like an it's okay kind of person, and so I think working and seeing so many sick people and not fully understanding why, we think older, we think diabetes, we think other medical cancer patients, they all do poorly, but really what I've learned and seen with COVID is that we have no rhyme or reason. I was looking at the patients that I was taking care of yesterday in the ICU, and the average age is in their 50s, and we had young guys as in their 30s, younger than me, 31. I'm 32, so I guess like a little bit younger than me, all the way up to 70s and 80s, and some of them have no medical problems besides just this COVID. I think seeing them and seeing how sick you can get without even having any medical problems showed me, there's really no on our end rhyme or reason that we can understand. And I think it was very sobering for me to see that. And I think it's helped me to be a little bit more balanced in terms of understanding and learning the statistics of, okay, likely you will do fine if you are XYZ, but at the same time, it's still very possible that you can get very, very sick, even without having anything wrong with you.
Yeah.
So obviously, like, I think one of the things I think about a lot is like each person has their own circumstances that they have to figure out, during the pandemic, right? There's no one clear cut answer. There's no like one clear cut method to quarantine to pandemic well. But from your perspective, through all the things that you've seen and witnessed, and through those things, what would be words of advice that you could give to folks who are looking for some clarity, looking for some answers on how can we like try to figure out what that path looks like for myself?
Ooh, okay. I feel like I have answers, but I don't know if this really answers your question. I think navigating through COVID, both as a physician and then, as a church member, as a father, leader of our family, trying to guide our house church, I think what I've learned is that, we can provide all this medical advice and we look at the statistics and this is the patterns that we see. But similar to how COVID works, like it's COVID affects everybody so differently, right? Like I was saying, like people who have these chronic diseases may get really sick, and there are people who have no chronic diseases that may get really sick. So it's very unique to each person how COVID affects them. In the same way, I think how we deal with this pandemic is very personal, right? I think, or what I've seen is that everyone has a different level of comfort in terms of what they feel comfortable with, and everyone has a certain level of risk, right? Because at the end of the day, there's a balance between like we were saying, Juan, who's able to work from home. Well, I guess not Juan, but a lot of people now are being able to work from home. They are able to quarantine, but there's a lot of people, a lot of my patients who have no choice. Not only are they not able to quarantine, but now that some of their kids have time, they bring them along to work to help them. I have patients who are custodians who they don't know how they got COVID, but they still have to go to work because they can't afford to feed their family if they don't. The risk to them, the benefit outweighs the risk for them. And so that's understandable, right? And how can you ask someone to not go to work when this is their livelihood and they literally have no choice? And then to have a blanket statement say like, hey, you all have to quarantine, I think is also kind of difficult to impose on people who can't. And I think as a leader, even as a medical profession, all we do as a doctor, I provide medical advice, and that's all it is. It's just advice. And at the end of the day, it's up to my patients to accept this advice. And I think, like as a house church shepherd, I have advice, but at the end of the day, like I have no authority. I can't force someone to do something. As a doctor, I can't force my patients to take their medicines. I can't force my parents to take care of their kids. I can't force patients to come back to me. And so whatever authority I have as a physician is what my patients give me, right? And so even as a leader, as a church leader, or even as a father or as a husband, I have no authority over you guys as a shepherd except whatever y'all agree to give to me. And same thing, like I have no authority over Abby except what she perceives, right? And same thing with Judy. I think, there's just a balance in terms of all of that. And I think having that understanding that I share things based off my experience, and then from there, each person kind of takes it their own way. Does that answer your question?
No, I feel like this is so refreshing to hear because, like, for us, right, you're here because we are inviting you as physician perspective during this time. But that's like maybe our third or fourth identity that we might see you as, right? We definitely see you as house church shepherd, friend, father. Like, those are way up there. And then we always know you're so busy with residency, right? But we don't actually get to kind of hear this part of it. And I think to hear how almost sometimes these identities you carry actually could clash with one another and what you've learned in the hospital, right? And then what you've learned or like what you've like gained in experience and wisdom elsewhere too. But I feel like the way you're sharing it just is really refreshing to hear, Ryan. Or should I say Dr. Chief Lay, because he's that co-chief resident for senior year. I don't know if those terms are correct. That means a really big, big deal. It means no extra money, but a lot of extra work and advocacy for his team members, for his patients, just in a lot of ways. So we're really proud of you that even through the draining days you've had, right, you're someone that is able to see the light. You're, excited about pursuing fellowship even because of these experiences, right, and ways that you can provide for your family by going to the COVID ICU units, right? And things like that. So I think we're just really humbled and grateful to get to see all these sides of you.
Yeah. I think one thing I'll add is Ryan and I have known each other for over almost 10 years now. And I think one of the things that I've always really appreciated is just like the willingness to lead from not a place of I lead because like I have the authority, like you mentioned, but like a place of like genuine care and heart for people. And I can see like as you've been doing more and more as a doctor and as a resident now, like chief resident, and then like hearing you talk about it now, I was like, wow, that core part of your identity is like so consistent, like everywhere you go, like you bring it to your family with Judy and Abby, to our house church, and then to your family, and now to your patients, and now like the residents that you're going to be in charge of. And so I'm just excited to like see you lean on that strength and like really bring that out to help push folks and to really support them wherever they are. So just wanted to highlight that because I feel like that's such a consistent part of your identity. That's kind of like floating just in its own, and it has its place in like all the different things that you're part of.
Yeah, that's good.
Thanks, Juan.
House Church Shepherd Appreciation Day. Anyways, before we kind of close this time with you, Chief Lay, do you have any final words you might want to say to anybody that's listening, or even fellow residents? Or you don't have to have anything you want to say, but anything that you feel like, this is a platform where you get to share. So I definitely want to make sure you have that opportunity to have any last words.
Actually, I did want to share one thing. This is out of place, but there's one thing that I just remembered that I did want to share. Like one thing that I struggled with, like in my identity, during this time. A big struggle that I had was when this pandemic first kind of broke out. I was really excited because I think a part of me is, like I said a little bit earlier, it's kind of like an adrenaline junkie. So, it's all exciting. There's like a lot of chaos. We don't know what's going on. And then kind of being quote unquote like on the front lines, taking care of these COVID patients, going into these rooms and being at the forefront, learning so much, and then coming home and then being excited to kind of share these experience. But at the same time, I felt this sense of, oh, he's like unclean, like, oh, he sees these like COVID patients. So I felt this mixture of like gratitude. On some ends, I'd go to some places and they're, we appreciate our healthcare workers. We love you. Thank you for your sacrifice. And then on some ends, it felt like, oh, no, you're a healthcare worker. Like you cannot be here because it's unsafe and you're unclean. Oh, you deal with COVID patients? Oh, for sure. Then you need to be away from me. And so it felt on some ends very polarizing. Some people would love me and some people would despise me. I'd walk into Starbucks and I remember I got free coffee, and then there are other places where I was wearing my scrubs on my way to work instead of after work, and I would get these dirty looks. And so it was very, not just from the public but even from friends and family, and people would make like jokes asides about it, like, oh, you're unclean, maybe you should just sit in your car, don't come out of the car, kind of things. And so I think that was kind of difficult for me. And I think I really struggled with my identity. I'm proud, of course, to be a doctor, but at the same time, I felt a little ashamed, like I needed to hide it sometimes. And that was kind of difficult. Yeah.
I think that's important for you to, and like, to be honest, when you're saying that, I was probably more on the other end than like, I know, like, even when we're trying to figure out who we have to limit exposures with, like, to be transparent, like, I know that was, when you're describing that, like, something I would want to own up to as well. I'm glad you were able to share that. And that's probably a sentiment that's shared amongst a lot of people that have been on the front lines. And that's actually something I would want to discuss with our next guest, Pastor Peter, right? Like, how do we talk about what that looks like and how we respond to that? How to separate this disease from making it into what people could make it seem as like sin, which is not, right? And like, how do we talk about that healthily so it's not a scapegoat? So I really appreciate you bringing that.
No, I mean, I appreciate being on here. I'm thankful to be able to share this experience. I think, clearly talking to you guys, I think I'm still processing through it. It's been like 9-10 months, and I feel like the stories and the experiences I have, there's still so much, and I'm still like trying to distill it all. And I think like it seemed like in my rambling even now, but yeah, no, I'm thankful to share this experience and to help me process through kind of what I experienced. So this podcast I'm thankful for too.
Appa, I want to press A.
Okay, can you say hi to Uncle Wanhee and Eunjee Imo?
No.
Hi, Abby.
Press A and then.
Yeah, I think every time we have these longer conversations, I think I get to see that part of you that is always processing and always thinking and like going deeper, and I know that for me that's like something that is harder to do sometimes, and part of the reasons like why I want to do something like this. And so I just appreciate you coming on, sharing your thoughts, helping us see that perspective that a lot of us don't get to see, So I hope this was an enjoyable experience for you, and hopefully there'll be future episodes where you can come on and share other parts of thoughts and things like that.
Ryan, thanks for joining us. And we appreciate your processing on the podcast, where you hopefully were able to enjoy the wonder. Okay, ready? One more time, Ryan.
You want me to say it too?
Together, ready? 1, 2, 3.
Enjoy the wonder.
Wani hates it when we do this part.
Um, yeah, I really appreciate Ryan just coming here and sharing some stories, especially from the hospital that we don't get to hear about as often. Since Wanhee and I don't know too many people that were hospitalized, but we do have some friends close to us that did get COVID and thankfully recovered. And so while everyone has their unique story, we wanted to create this space to share from one of our friends who had gotten COVID last summer, what his experience with it was in terms of symptoms and recovery, maybe some isolation and just further insights from his time. And so without further ado, we have your very own 77 Alex Nam.
77, wearing black and blue, 5'11.5".
Generously
No.
estimated, rounded up. Okay.
6 foot
Welcome
on
back
my
to the
life, bro.
podcast. You are the first guest to reappear, not counting married people.
That's true.
Yeah,
That's true.
Yeah.
back to back.
Back to back. Um,
Ah.
all right, Alex, why are you here with us today?
So, like y'all told the listeners, I had COVID, and it was a wild, horrible experience.
So backtrack it for us. It was last summer,
Yeah.
and if you can just kind of paint the picture for our listeners to visualize what happened.
Yes.
Especially because at that point, we didn't know many people that had COVID. So you were the first friend for a
Oh
lot
yeah.
of us. Yeah.
Oh yeah. I like to say I'm an early adopter on many things, but this was one I wasn't proud of. So what happened was I normally work in San Francisco, and back in 2020 spring, we all thought our lives would be back to normal by summer, fall, whatever. We're making bets with friends. Hey, ha ha ha! Oh my gosh, we could work from home for a month. Great, ha 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 ha. Then we went on lockdown, and then my company, Google, shout out Google because I love Google. Whoop whoop. They told us don't come to the office until July of 2021, which is now extended to September 2021 because the vaccine rollout is horrendous.
Dang.
But yeah, so we found that out in April. So I thought, oh wow, we could work anywhere for a year and a half. I'm in a long distance relationship. Love my girlfriend, Jen Lim. Ow, ow, ow. So I thought, you know what? I'm gonna make this relationship, take it to the next level, be short distance, be a normal couple for once. So I flew to Houston. Now, I really hope I didn't get it on the way there. I was wearing a mask, but I was also on a plane ride with a bunch of elderly people. So I'm hoping I didn't get it on the plane ride. My guess for folks that if you have gotten the virus, it's a waste of time to try to pinpoint when and how you got it. It's just going to make your head hurt. But when I got to Houston, 2 weeks after, I started feeling a little off. And then I got tested and got sick. But when I got to Houston, I worked out at Jen's apartment gym, and there were folks around me that weren't masked up. That's where I think if I could pinpoint it, how I got it. But it was exactly around 2 to 3 weeks after I landed. I got tested. Jen was telling me, you don't have it, you don't have it, you don't have it. But there was a part of me that thought, wow, I think I have it because
You're Alex Nam.
Yeah, and my luck, knowing my luck, it's either horribly horrible or amazing. There's no in between in my life for anything that I do. I either work super hard at it or don't do it at all. So even when I was building my desk, I did it at one sitting. But when I really didn't want to do it, I pushed it off for 3 weeks. But yeah, so I got it, and I felt everything, every symptom you hear about, and it just sucked. Like taste, smell was gone for 2 days, body chills, exhaustion, and I knew I was exhausted because while I had it, and Jen was supporting me throughout all this, and she figured she got it too, but she got tested like 3 times. It came out negative all the time. It's just hard to predict the behavior of this virus. I asked her to arm wrestle me. I was like, let me see how tired I am. We arm wrestled. I gave it my all. She crushed me. In the middle of it, she said, are you even trying? And I was like, wow, dang, Corona is no joke.
Wait, the question is, does she normally beat you? How badly do you normally beat her, even when you don't have COVID?
Yes, that's a really good question. Jen is a really healthy, powerful individual, but normally I crushed her. Yeah,
You sound
Are
so
we?
proud.
Is there
yeah.
evidence? Do we have evidence?
There is evidence. You'll find out in the next episode. She can be the next guest to prove that.
On our podcast.
But yeah, I mean, symptoms wise, felt everything. What my original plan was to be in Houston, go to Dallas to see my parents, and come back to Houston. I ended up staying at Houston from May to late August, early September because I was so afraid of infecting my parents and other people with it, and I literally didn't see a soul for 3.5 months. I became pale. I was angry all the time. I was stuck in an apartment because I was just so afraid that I would not help the cause of fighting this virus.
Mm.
And I think, what a couple people kind of asked me, like, I feel like you sound proud that you had it. And that kind of made me upset. I'm not proud I got coronavirus at all. Like a few folks asked me that. And I was like, I'm just not shy about telling folks about it because people need to know. It's like
Yeah.
it could really cripple you. It spreads like wildfire. So for me, when people ask me about it, one, I told all the folks I saw. I did see people masked up, like social distancing and everything. So I saw everyone I saw, told my parents to tell everyone at church, told friends I haven't talked to in a while. I just told anyone that I asked or I caught up with because I even told coworkers that are in California because it gets a little more real for people when someone they know gets it,
Yeah.
Like, I honestly can't pinpoint how I got it. I'm healthy, but I got it. And I mean, here we are now. Now everyone knows. Like, it spreads, it kills. So the mental health aspect of it was really tough for me. Like, not as extroverted as I am, not being able to see people, being a burden to my girlfriend. I was useless and just angry about everything. I told Jen I hated Houston for like 3 weeks. Like, I hate Houston. Just brings me curses or whatever. But I love Houston.
And the
But
blessing of your girlfriend.
yeah, so it's like I was just down, angry, and I'm a lot better now. Mental health is a lot better now, but it's just always on the back of my mind though. Every time I see someone, every time I do anything. And now I didn't have that kind of immunity for 3 months. I was not immunity, but you're supposed to be safe for 3 months after you recover, or like it's hard to get it again. But that's gone too. I'm just as weak as everyone else again. So I could be a 2-time COVID guy anytime.
Oh gosh, let's hope not. I think it's funny because when Alex came to Houston, he was calling me and he's like, Nuna, Jen is putting a shot in my arm, the Tdap booster shot, so that I can go hug Jaden and kiss Jaden. And then
Mhm.
sadly, you got coronavirus before any of that could happen. So I know in a personal level, I was sad to choose not to get anywhere near you when in fact, right, like that 3 month immunity, during that time is when I actually didn't know if I was supposed to go near
Mhm.
you because we didn't know what this virus meant. Did you
Yeah.
feel like that from a lot of people, or like how did you feel in terms of people maybe putting a certain cone of shame, if that lack of
Yeah.
a better word?
So I was really transparent about it, but
Mm-hmm.
I think in general, maybe in the Asian American community, or maybe in general,
Mm-hmm.
it's hard for folks to tell folks that they had it. Um,
Yeah.
Yeah.
and understand that it could be shameful because it kind of signals that you're an irresponsible person or something like that. But it really,
Which goes against one of Asian Americans' like traits, like character traits
exactly.
in a
But
sense. Yeah.
you're really not. Like,
Mm-hmm.
you can get it at the grocery store masked up anytime. You can get it
Mm-hmm.
anytime. And it takes a split second for to transmit. You can get it on a run. I saw a graphic where if you're running without a mask and you pass by another runner that has it, that's how you can get it. So like, I don't think people should feel shameful about it. And for me, when people were hesitant to see me or didn't want to see me, I was fine with it. Like, I was like, I'd rather folks are more careful.
Yeah.
It was interesting, and that was crazy. I was ready to see Jaden with the Tdap. I didn't even know what a Tdap was. Got that shot, and I got it 2 days later. Coronavirus.
Yeah.
Yeah, crazy.
I think it's when you think of hindsight and the fact that you are someone that got it and the transparency that you were able to kind of already put on yourself is something that is very rare. And so, not that, I think not that it's good. No, I don't know. That doesn't make sense. Not that it's good that you got it, right? But
Mhm,
I
mhm.
think it also helps break some norms that maybe even your friends or your peers or us, like we can learn about, and like what is comfortable to share.
Yeah.
What led you to? So you said you were stuck inside for 3 months, right? Even with the
Mhm.
immunity,
Mhm.
what made you decide to stay inside? And then after the 3 months, what changed your mind and like you were like, I need
Yeah.
to get out, you know?
So I also operate in a devil's advocate way of thinking when it comes to health and stuff like that, or just like I'm a huge risk taker in terms of like anything else in life, like having fun, or finances or whatever. But it's like for health, I try not to minimize risk to zero if possible. And at the time, I just didn't know what to believe. Like
Yeah.
there's so many different resources. Like there's people telling me you should get tested again. You shouldn't get tested again. You're good after 2 weeks. But in my mind, like the CDC is saying 2 weeks, but I'm like, how do they know? you know,
Mm,
it's 2 weeks. Like how do you even test for that? Experiment that? I felt like 3 months was a good time where I thought, okay, I think I don't. If I go see my parents, it'll be okay. But I was having nightmares of me infecting other people and like affecting their lives. I was getting crazy nightmares. Like Jen was telling me I was grinding my teeth a whole lot, and I was getting. And I think that's just how I operate. Like if it involves like people I care about, I get super super stressed. After 3 months though, I was going insane. I love like Jen was the only one keeping that thread of sanity, but I was going insane not because trying to not see other people, it's just being at one place. I didn't leave that apartment and I was alone a whole lot. She has work, she's busy, so I was looking at a white wall every day for 9 to 10 hours a day. So I was just like, oh my gosh, no one around me. Didn't even go get mail. And I know that's an extreme, and listeners will probably think, well, that's really extreme. But like, that's how scared I was of it. Because if it could put a young 20-something male to be really struggling for a week, imagine the effect it'll have on my parents, on older folks, or who knows.
mm,
Like, so I just was always scared all the time. I didn't want to be near everybody, but I couldn't take it after 3 months. Like for my own sanity, I had to. I had to taste fresh air. So I went on a trip with Austin with two friends, Chris and Joanne, and I hope they noticed. That was so healing for me, and I'm so thankful that they dealt with me because I was relearning how to talk to people again. I was kind of like snappy or whatever. Like I wanted to do what I wanted to do and stuff like that. So that trip was really healing and also gave me more comfort to, okay, maybe I'll get tested again or something just in case and go see my parents.
mm.
Mm.
Do you feel like the 3 months inside changed you? Like, how do you think COVID has like affected how you view yourself, like your identity, like who you are as a person?
Yeah, that's a great question. I mean, it changed it changed everyone's lives, I think. Like this
Mm,
whole situation, COVID and pandemic. I think COVID, when someone passes away in our lives, that's a reminder of, okay, health is wealth for everybody, right? And then that thought fades when, our lives just go on and go on. But COVID was a daily reminder of life's fragility, brevity. Like, so I think it made me a more thankful person. It helped me stay more grounded, and it's opened a lot of doors for me to pursue a lot of other things. It's
Mm.
just a time of perspective. It's given me a lot of perspective. Like every day, like we're all still dealing with this. And I think Joe Biden was saying like the vaccine rollout hopefully by spring or summer, but
mhm.
we'll see. But like we're still dealing with it, and I think I'd like to say it made me a better person, but it just sucked for everybody. So everyone had to adapt. Yeah.
I wonder how we will be like when we're all like if life returns in terms of social normalcy, because even how you were saying you had to relearn social awareness in certain ways with Joanne and Chris. I feel like I experienced that too, just from being on the extreme of distancing. It's something you made me think about, because I went to early morning prayer once and I remember seeing people afterwards, and like obviously everyone was apart, but I remember being so weird because I had seen people in like a setting that I hadn't been in like at least a year.
Mhm.
Um,
Yeah.
how a lot of us will have to kind of relearn
Mhm.
social skills,
Yeah.
um, outside of the intimate people you do see.
Mhm.
Yeah.
I think, yeah, it's a real thing. I was listening to another podcast yesterday. um, but the host was just talking about like how people's social skills and like energy has just dramatically decreased, right? Like she was saying
Yeah.
she went out for a conversation with two other people for an hour, and the next day she was just exhausted because like
Mm,
we're just not used to that anymore. Outside the people that we're close to, we're like don't know how to talk about things anymore. Sometimes there's like really nothing to talk about,
yeah,
because lives haven't really changed that much since in quarantine. Like day to day is very similar,
yeah, yeah,
but then everyone's talking about like the big things that are happening, but everyone's talking about it. So what else is there to talk about,
exactly.
Yeah.
And I feel like we've had a lot of extroverted people on this show, but even like Stefan was sharing earlier about, the energy he gets from people and how hard that is. And it really is affecting like mental health in different ways because of how we find energy and how we feel alive and how that's almost directly against how COVID is allowing our energy to be. Does that make sense what I'm trying to say?
Yeah.
Yeah,
And
yeah,
you talked about other open opportunities through this time. What does that mean?
yeah. So I think during quarantine, a number of us have been pursuing side projects because like we're working at home and you just at home. You don't do anything after work, you don't hang out with friends, you're not even able to volunteer at places, you don't do anything. So, and then a lot of folks unfortunately had to deal with layoffs too. So like we're all having to adapt with more time in our hands. So for me, I felt super blessed to keep my job, but I think just being in that work from home cadence and just being at home, having a lot of thoughts to myself, I reconnected with a close friend of mine. His name's Wesley, and we started a little bit of a side hustle called denalily market, where we, sell, collect cards, collectibles, stuff like that. I doubled down on some like investing. I've been reading more podcasts, like listening to this podcast repeatedly, especially episode 2. Uh,
The last
The
the
10
last
minutes.
10 minutes. Yeah, the
yeah,
last 10
the
minutes.
last 13 minutes and 22 seconds. Just kidding. But yeah, I think it's that's the beautiful part of it. I see a lot of folks pursuing passion projects and things that they wanted to with the time that has been presented before them, and a lot of beautiful things have come out of it. So that's the thankful part of just
Yeah.
being in quarantine, and just the impressive parts about humanity, just making the best of a situation. So yeah, I'm excited what the post COVID world will look like for some of the personal things I've been doing. But it's been crazy. I'm just ready to drive around and go to people's houses. And
Yep.
I was looking at pictures of my trip in Japan last year, and I got really sick in Japan, so I might have gotten COVID like really early in Japan. Who knows? But I was at a trip in Japan with two of my closest friends, and we were at the club, we were shopping, and we were at the Japanese subway where you could hear the person next to you breathe. I don't, I just feel like that'll be so awkward now. It's
Yeah.
gonna take
Yeah.
years, I think, to get used to. I'll probably continue to wear a mask. So that's interesting to think about.
So, I mean, you were talking about you're either really lucky or really not.
Hmm.
And you got COVID, which, you were unlucky in that, but you made it out for good. And now you're super lucky with all the Denali happening and all the
Yeah.
great things happening at work. So it sounds like your life is trending the way it's used to.
Yeah, no, I feel really thankful, but it keeps me grounded. I think
Yeah,
COVID and the pandemic, it keeps you grounded because I know folks that have lost loved ones due to COVID.
absolutely.
So I think we have to live life
Mm-hmm.
knowing the brevity of it. I'm just thankful. Every day I feel thankful. Every day I complain a ton. Like Jinna knows I complain a ton, but at the end of the day, I'm always reminded, like, man, like it could be so much worse. And I'm just thankful for health now. I want my friends and family to be continue being healthy and to continue to practice safe protocols. And yeah, I think it's reminded me, like with being with my mom and dad, I'm trying to get into a habit of telling them like I love them more,
Mm.
because it's just been a tough year. So many folks have gone through so many inexplicable things. So I never want to forget that too. As much as even if it's painful thoughts, I want to honor people with the way I live as best as I can. So I think that's been a huge learning point for COVID. Despite the physical drawbacks, the mental toll just got to keep pushing. The human spirit is stronger than we think. I think 2021 is going to be a great year. It
Mm.
has to be. 2020 set the floor, so it has to be.
Yeah. I have a last question for you, Alex. So one of the things that I've like struggled with during this time is when I know that one of my friends or like people I'm close to has COVID, like what the best way to like help or support or like reach out. Because sometimes like if you ask, hey, like can I help you with anything, then they feel bad because like they don't really want to burden the other person, but then you want to help and it's like this back and forth, you know, of like, so like as someone who like had to go through that, what's like the best way for someone who doesn't have COVID or is like a friend, what's the best way for them to support that person who's going through that?
Yeah, so man, everyone's different. And I think with Asian Americans, we're so hesitant to
Yeah.
ask for help or be receptive of help. I think with
Oh,
COVID,
yeah.
it's complicated to receive help because the person that has it doesn't want to be around others. But I think just words of encouragement, words just that signal I'm thinking about you, praying for you, goes a long way. And honestly, like if I'm alone and dealing with this, and I'm thinking back, if I didn't have Jen, I would have loved people to drop off food from me or something because I was scared to go out, you know?
Yeah.
And if folks aren't receptive of that, I mean, that's tough and I get it, but I think we all need to help each other. I think with Asian Americans, like we want to have this portrayal of I got it figured out, I'm doing okay, I could beat this, but no, that I think is a really toxic mentality, and we just need to be able to receive help. So I think if if I know someone that has COVID right now, I think one, I would just continue to encourage them. One, like let them know, like, yo, I'm here, praying for you. Let me know if there's anything you need. Like, I will be safe. We don't even have to be in contact. Just let me know, and just know that it's not an embarrassing thing. Like it's
Mm.
not. It's not something to be embarrassed about. And if you were going out and practicing unsafe protocols and you got it, it is what it is. Now you learned. You can't dwell on that. Just encourage the friend that you're not judging them. Because I think like even for me, like I had moments like, man, are people judging me? Do they think I'm an idiot or something like that? Like or selfish. But I struggle too at times now when I see folks on social media and stuff like, man, they're going out a ton or doing a ton, but they're still my friends. I love them. It's they're doing it because they're going crazy mentally. Yeah. So back then I'm thankful for Jen and stuff, but I'm even more thankful for the folks that reached out to me. Like shout out to my friend Sean Kim. He called me, and we haven't talked in several months, but he found out because my mom told his mom, and I was completely fine with that. And he called me to encourage me, to ask me how I'm doing, to ask me like, dude, like, are you okay? Can you smell? That's always the first question. Yes, I can smell. But that really went a long way for me. Just having several friends call me, ask me how I'm doing, and I could shout out a lot of people. Just want to shout out Sean because I think he was the first one to do that, and that resulted in a good long catch up session about our lives. So that was really awesome, and I think that's what we can try to replicate for folks that we know are struggling with it now.
Mm. Words of deep wisdom from Alex Nam, former COVID patient.
Shout out Sean, shout out Jen, shout out my crew, Denali, shout out Denali.mkt.
I want to learn more about Denali, but a different time.
Yeah, we could do another episode on that, and then rename the podcast to Enjoy the Wander Nam. There's no word.
Yeah, shameless plug that he will be a recurring guest on this podcast. Yeah, I think this podcast always lets me feel very humbled because I have such joking relationships with so many people with like Alex, but when we have conversations like this, I'm always humbled at how like mature this little big donko is. So it's always nice to hear, and I appreciate the transparency. I think transparency is something you set the bar in, especially early on with COVID, which is something that's really hard, especially for Asian Americans, but just in general with how to navigate this during the pandemic. And so I do appreciate that because you let all of your close ones know right away, anyone that you might have had contact with, so that they could figure things out before they maybe could have spread something. So I think the way you handled it was something that was so humbling. And when I think back about it now, something we wouldn't have expected from a lot of people. So,
Mm.
so proud of you.
Yeah, that means a lot. It's been a crazy ride, and are we done?
Yep. Well,
No smooth transition out of that one.
in 3, 2, 1. Enjoy
Enjoy
the
the wonder.
wonder.
A drop in the ocean, a change in the weather. I was praying that you and me might end up together.